Hello everyone, and welcome to our second webinar in our four-part webinar series. My name is Mariah Hawkins, the Insurance Plans Project Coordinator, and I'm joined by Ashley Anguiano, the Insurance Plans Specialist. Today we'll talk about comparing health plans, discussing what is an HSA, and how an HSA could benefit you if you're enrolled in a qualified high-deductible plan, as well as going over some of the online tools that we have that can help you manage your benefits. Together, we're here to guide you through the complex landscape with clarity and ease and help you make informed decisions for the plans that you wish to enroll in. We're excited to share insights that will empower you and your families, so let's get started. And now to introduce our insurance team. We have myself, Mariah Hawkins, the Insurance Plans Project Coordinator. We have Ashley Anguiano, our Insurance Plan Specialist. Hugh Dennis, our Deputy Director of Church Staff Finances, as well as our Insurance Plans Director, and Richard Nugent, the Director of Church Staff Finances. Today we're focusing on our core purpose, empowering both administrators and plan members. We want you to leave this series feeling confident and advocating for yourself and your loved ones. Our commitment's not just about sharing information, but about fostering a sense of empowerment and self-advocacy. Remember, understanding your options is the first step in making informed decisions, so we're here to guide you through that process. Let's keep these goals in mind as we move forward to compare different health plans and tools available to you. Today, we'll dive into some crucial topics that can significantly impact your healthcare decisions. First, we'll compare the available UUA health plans, including our UUA Medicare Supplement Plan. This will help you understand your options and what might best suit your needs. Next, we'll discuss health savings accounts, or HSAs. These can be a powerful tool for managing healthcare costs, and we'll walk through how they work. Finally, we'll show you how to use our online tools effectively for plan comparisons, empowering you to make informed decisions. These topics are essential for making the most of your health benefits, so let's explore them together. Up next, we're going to compare the different plans we offer here at the UUA. With the information we provide, this can help you decide which plan fits your needs best.
For a quick and comprehensive overview of our health plans, the UUA Health Plan Comparison Grid is a great one-stop resource. It provides a clear, side-by-side comparison of in-network coverage across key services, making it easy to see how each plan stacks up at a glance. You can reference it on our website at uua.org/insuranceplans. Now, let's review some of the key benefits covered under the standard PPO plan, also known as our Gold Plan. This plan offers a wide array of diagnostic and preventative services that are crucial for maintaining your overall health, as well as preventative care such as routine physical exams and immunizations. The beauty of this plan is that these services are covered at 100% in network, so you can focus on your health without worrying about unexpected expenses. Let's dive into the standard PPO plan and see why it might be the right fit for you. First, this plan is ideal if you prefer predictable cost. With copays for doctor visits and prescriptions, you'll have a clear idea of your expenses each time you seek medical care. Consider this plan, especially if you expect to have frequent medical visits, need chronic condition management, or require ongoing care. It's designed to support those with ongoing healthcare needs. Finally, while the premiums might be higher, the trade-off is lower out-of-pocket costs when you do need care. This balance can provide peace of mind and financial predictability. Now, let's move on to explore the Silver High Deductible Plan and see how it compares. The Silver High Deductible Plan comes with a $3,000 individual deductible and a $6,500 out-of-pocket maximum. After meeting the deductible, you'll enjoy 85% coverage on most in-network services. Now, a key feature is the integrated prescription and medical deductible. This means your out-of-pocket expenses for prescription and medical services contribute to the same deductible. This plan is a great middle ground option. It's particularly beneficial if you're interested in the saving opportunities provided by a health savings account combined with reasonable coverage. The Silver plan suits you if you're generally in good health and don't expect frequent doctor visits. It allows you to save on monthly premiums, however, be prepared to pay more upfront when you do need care. For those opting for the HSA version, there's a significant benefit. The health savings account offers tax-free contributions, which can be a smart way to manage healthcare expenses. Think of it as a financial cushion for future needs. This plan is all about balancing costs and savings, giving you the flexibility to choose based on your health needs and financial goals. Now, let's look at the Bronze High Deductible plan. This plan has a $6,000 deductible and a $7,500 out-of-pocket maximum. After meeting the deductible, it covers 80% of most in-network services. One standout feature is the full coverage for preventative care. This includes essentials like physicals, immunizations, and well-woman exams, all covered at 100% when you stay in network. Additionally, this plan integrates prescription and medical deductibles as well. Remember, this plan is designed for those who want to minimize monthly premiums while maintaining a safety net for major expenses. When considering the Bronze High Deductible plan, it's important to keep a few things in mind. First, if you seldom visit the doctor, this could be a good choice due to its low monthly premiums. The best way to think of the Bronze plan is a safety net for those just-in-case moments. You should feel comfortable paying out of pocket for medical services.
Now we'll go over our UUA Medicare Supplement Plan. We'll discuss how it works, who's eligible, what to do to enroll, and how long you can continue on the supplement plan once you retire. So, how exactly does the Medicare Supplement Plan work? Well, Medicare Parts A and B pay first. This covers about 80% of approved medical costs. The Medicare Supplement Plan, oftentimes called Medigap, helps pay the other 20% on things like deductibles, coinsurance, and copays. The Medicare Supplement Plan works alongside your regular Medicare coverage. It does not replace it. Who is eligible? The UUA Health Plan offers our Medicare supplement for active employees whose age is 65 and up and qualified retirees whose age is 65 and up. In order to enroll in the supplement, enrollees must be enrolled in Medicare Parts A and B prior to enrolling. We do require proof whenever you submit an enrollment form, so you must have a copy of your card at that time. If you are enrolled in the UUA Health Plan and your congregation has more than 20 employees, you must stay on your current plan, either the standard PPO or the high deductible plan. Your congregation's PPO plan remains your primary health coverage. In this situation, you are not eligible for a Medicare supplement plan, and there's no need for one. You will still have Medicare Part A, but it will only pay after your employer coverage. You can choose to enroll in Medicare Part B, but it's not required while you are still actively working, and in most cases, there's no financial benefit to doing so. For congregations with fewer than 20 employees, if an active employee is age 65 or older and enrolled in the UUA Health Plan, they will typically have Medicare Part A automatically and will need to enroll in Medicare Part B. They may also choose to enroll in the UUA Medicare Supplement Plan. In this case, Medicare becomes the primary payer, and the UUA Medicare Supplement Plan becomes the secondary payer. To meet Medicare's requirements and make this change legally, there are a few simple steps. The congregation must complete a Medicare waiver letter confirming that they have fewer than 20 employees. This letter must be signed and submitted before the Medicare supplement coverage starts. Second, if the employee is already enrolled in the UUA Health Plan, they'll use the benefits change form to request the switch. They'll need to upload both the Medicare waiver letter and a copy of their Medicare card showing both Parts A and B coverage. If the employee is not currently on the plan, they can enroll in the Medicare supplement using our online enrollment form and select loss of coverage as their qualifying event. These steps help ensure compliance with Medicare rules and a smooth transition into the correct coverage. How long can you keep your Medicare supplement plan after retirement? The answer is indefinitely. You must be enrolled in the supplement plan prior to retirement. However, if you choose to cancel or terminate your coverage at any point, you won't be able to re-enroll in the plan unless you're rehired by another participating UUA congregation or employer. Now that we've covered Medicare and the UUA Medicare Supplement Plan, let's shift gears and talk about another important piece of the benefits puzzle, health savings accounts, or HSAs. If you're enrolled in the high-deductible health plans we offer, an HSA can be a powerful tool for managing healthcare expenses and saving for the future. We'll go over how HSAs work, who's eligible, and some key advantages they offer, especially when it comes to taxes and long-term savings. Let's take a look at how HSAs can fit into your overall benefit strategy. Qualified high-deductible health plans are designed to work hand-in-hand with health savings accounts, or HSAs. These plans typically come with lower monthly premiums but higher out-of-pocket costs. That's where the HSA comes in. It helps you cover those out-of-pocket expenses like prescriptions, coinsurance, dental, vision, and other qualified healthcare costs while you work towards meeting your deductible. Together, a qualified high-deductible health plan and an HSA can offer more control over how you spend and save on healthcare. So, how does an HSA actually work? You can contribute to your HSA in a couple of ways, either through automatic payroll deductions or by making deposits directly from your own bank account. The amount you choose to contribute is up to you, and in some cases, your employer may also add money to your account. Just keep in mind that the IRS sets an annual contribution limit, which includes both your contributions and any from your employer. Each year, those limits may change slightly, so it's important to stay up to date. The great thing about an HSA is that the money goes in tax-free, grows tax-free, and can be used tax-free for qualified medical expenses. When it comes to health savings accounts in 2025, the IRS has set clear contribution limits to keep in mind. For an individual, you can contribute up to $4,300. Family coverage, the limit is $8,550. For catch-up contributions, if you are age 55 or older by December 31st, 2025, you may contribute an additional $1,000. These limits include both your personal contributions and any deposits made by your employer. If, for example, your employer contributes $1,000 towards a self-only HSA, you can contribute only $3,300 to stay within the IRS limit. Remember, these limits are total annual maximums, regardless of how or when the money is deposited into the account. Now that we've reviewed what you can contribute, let's explore how these tax-advantaged funds can best work for you over time. Another great feature of an HSA is that it's portable income. Unlike other types of spending accounts, like flexible spending accounts, FSAs, you own your HSA. That means the money in your HSA stays with you no matter what. If you change jobs, switch health plans, or even retire, your HSA goes with you. The funds are yours to use now or in the future for qualified medical expenses. It's a flexible, long-term savings tool that gives you real control over your healthcare dollars. Another key benefit of an HSA is that it grows over time. Unlike use it or lose it accounts, the money in your HSA rolls over from year to year. You never lose unspent funds. Even better, your HSA balance earns interest, and once you reach a certain threshold, many HSA providers allow you to invest your funds in mutual funds or other investment options. This means your HSA can function like a retirement savings tool for future healthcare expenses, giving you both flexibility and long-term growth potential. One of the biggest advantages of an HSA is that it comes with triple tax savings, something you won't find with most other accounts. First, your contributions are tax-free. If you contribute through payroll deductions, the money is taken out before your income tax is applied. Second, any interest or investment earnings in your HSA grow tax-free, so your balance can increase over time without being taxed. And third, you don't pay taxes when you use your HSA funds for qualified medical expenses. So, from start to finish, contributing, growing, and spending your HSA gives you significant tax advantages. Let's talk about what you can actually use your HSA for. HSA funds can be used to pay for a wide range of qualified medical expenses, which go beyond just doctor visits. Here are some common examples: medical deductibles and coinsurance, prescription medications, dental care, including cleanings, fillings, and even orthodontia like braces, vision expenses such as eye exams, glasses, contacts, and even laser eye surgery, and over-the-counter items like pain relievers, allergy medicine, contact lens solution, and first aid supplies like bandages. The list is surprisingly broad, making your HSA a flexible tool to cover many everyday healthcare costs, tax-free. Now that we've covered plan options and how to manage your costs, let's look at some online tools that can both help members and employers navigate the UUA health plan more easily. We'll walk through a few key resources, like our online premium calculator, which helps estimate your monthly premiums based on your plan and coverage tier, the UUA Health Plan website, where you'll find forms, guides, and more important updates. The Highmark Member Portal is going to be your go-to place for claims, coverage details, and personalized health resources. These tools are designed to make it easier to understand your benefits, plan ahead, and stay on top of your health care. Now let's look at how to use the UUA Health Premium Calculator. This is a simple tool that helps you figure out what your monthly premium will be. To get started, you'll need just a few things. First, you will select which plan you're interested in receiving the premium for. Next, you'll select the coverage level: employee only, employee plus spouse, employee plus child or children, or the full family. You'll enter the employee's birth year. And last, you'll select the employee's zip code, only using the first 3 digits. Once you enter that information, click the red button that says Calculate Total Monthly Premium. The amount you'll see is 100% of the monthly premium, the full cost. If your congregation is contributing a percentage towards that premium, you'll need to calculate your share based on what the calculator shows. It's a helpful way to see the total cost and compare different plan options. If you wanted to see the premium for the other plans, you can easily select the new plan and recalculate. If you have any questions or need help, please feel free to reach out to our team. Now let's talk about one of the easiest ways to stay on top of your health benefits, the Highmark Member Portal. This online tool, available through the My Highmark website or mobile app, gives you quick access to everything you need as a health plan member. Here's what you can do once you're logged in. You can view or download your ID card anytime, which is great if you need a copy before the physical card arrives. You can check claims and explanation of benefits to see what's been processed and what's been paid. You can search for in-network doctors, pharmacies, and other providers based on your needs and location. You can print a temporary ID card or request a new one if yours is lost or damaged. You can access forms and many more things, all from this one easy platform. So it's simple, convenient, and an easy way for you to manage your coverage wherever you are. Last but not least, another great resource to know about is our UUA Health Plan website. This is the main hub for everything related to your benefits through the UUA, and it's a great place to check whenever you have a question. On the site, you'll find benefit booklets and the benefits grid, which will give a full breakdown of what's covered and how the plans compare, important updates and announcements, including all the news about upcoming plan year changes like premium adjustments or benefit updates, and direct links to all the key forms, including enrollment forms and benefit change forms. Whether you're enrolling for the first time, making a change, or just want to review your coverage, the website keeps everything organized and easy for you to find in one place. Now, before we wrap up, we wanted to remind you about the last 2 webinars in this 4-part series. Webinar 3 is coming up on Tuesday, August 19th from 12 to 1 p.m. Eastern. We're going to cover Billing 101, how to pay your premiums, stay current with your invoices, and access those invoices online. Then on Tuesday, September 23rd, from 12 to 1 p.m. Eastern, we'll get into the dental, life, long-term disability, and vision benefits information. We really hope that you enjoyed today's session and got some good information out of it. The remaining 2 webinars will also have really good information, so we hope to see you there. And that wraps up the main part of our presentation. We're going to open the floor to any questions you might have about the health plans, HSAs, Medicare supplement, or how to use any of those online tools that we mentioned. If you have any personal questions, we do recommend reaching out to us via email at insuranceplans@uua.org just to protect your privacy. So now we'll open the floor, and if you have any questions you'd like to put in the chat, we can go ahead and read them and answer those as well.